story that has stuck with you throughout your time as a podiatrist?
Oh my gosh. So many patients and stories. And I think one of the really cool things about our profession is that, your patients stick with you. I mean, literally, they stick in your mind as far as the stories that you go through with them. But because you go through so much with them clinically and then maybe surgically, these are patients who, are with you sometimes a career long. I've talked a little bit before about gaining rapport with patients and how difficult and how challenging that can sometimes be as a young physician or as a female physician in general. I saw a patient through our school clinic as a favor for another physician who was on vacation, who had asked, can you just go in? All I need you to do is take a measurement of this ulcer. She has an ulcer, a wound on the tip of her toe. We just need to clean it up, put a fresh dressing on it, take a measurement for me. I'll see her again next week. Okay, no problem. The student comes out, presents the patient and says, I think it looks a little bit concerning. I think it might be infected. I go in and I see the patient, and that's just one of those things where you lay eyes on it for 2 seconds. You know immediately that this is wet gangrene. This is something where the patient has gas in their soft tissues. This is an OR situation, so patient needs to go right to the hospital. This is also my first introduction ever, walking into the room saying, hello, nice to meet you. I'm Dr. Pratt. I'm a foot and ankle surgeon, and we need to go to the hospital now because we need to amputate this toe. You think about how scary that is for a patient, meeting a stranger for the first time. I am not your regular doctor. I don't look anything like your regular doctor. I don't sound like your regular doctor. And I'm now telling you probably the most serious news that you've ever had, in the sense that we're going to need to cut this toe off today. And this is going to be a long journey to get this to heal. And so that's, one of these patient cases where she and I sort of had this odd start, this difficult start, as far as I didn't even know if she was going to trust me enough to meet me at the hospital, to get up to the operating room. And now she is my favorite patient in the world. I love to see her, and I hope she loves to see me. I still follow up with her every couple of weeks for routine care visits. And, she and I sort of were on this 2-year surgical journey of getting her wound healed, doing that amputation, complication after complication. And to see her now, that whole situation has manifested into a complete lifestyle shift. So this is someone who now has their diabetes under control, who no longer smokes, who has a totally different diet, who has never had a single foot or ankle issue since. And so that just is the biggest success story in my mind, not because we got her to heal and she's okay, but because her whole lifestyle is different. And if I even had a little role to play in that, that's just awesome. So I'm never going to forget her. So.
Well, thank you. Well, we're pretty much out of time here. I just wanted to, or I'm going to pull that one. We already talked about that one. I just wanted to say thank you again to Dr. Pratt for taking the time. And, I know she's got other things I'm sure she wants to get done with her evening here as the night is falling. And so we're going to go ahead and wrap up here. Again, I'd like to say thank you to Dr. Pratt. We appreciate her coming on. And I just want to also give a shout out to about the Student Doctor Network, Student Doctor Network at studentdoctor.net. We have a lot of resources available, and they're including a large community where you can talk to other folks about what it's like to go through the whole process of getting into and getting through health professional school. We cover a range of different areas, both from allopathic and osteopathic medical, as well as podiatry, optometry, dentistry, a number of different areas. We have a lot of resources. We are a nonprofit, so all of our resources are available to you through the generous support of our donors and available to you for free. So we invite you to come visit our site and check out our resources. And again, Dr. Pratt, thank you very much for taking the time. We really appreciate it.
Absolutely. Thanks.
And thank you, everybody. Hope everyone is doing well, has a good evening, and we'll talk to you at our next webinar. Thanks and good night.
If If you enjoyed this, click the thumbnail to watch the full video or visit Student Doctor Network to see the free resources we have available to help you become a doctor.